So we're going to demonstrate examination of the hand for common conditions that a GP might come across in the practice. First of all, just examining the back of the hands, looking for any lumps, bumps, or commonly you'd see the evidence nodes on the DIP joint. You might see some Garrett's pads, which is commonly seen in men following a Dupuytren's contracture. Look for any wasting of the first dorsal introsei, like in this case here, which might suggest ulnar nerve compression, and also any guttering of the other introsei. Okay. So then you turn the hand over and have a look for any wasting of the thinner group of muscles, which may be seen in advanced carpal tunnel. Look for any curling of the fingers or any cords that may run commonly into the little finger or the ring finger. And finally, if you lift it up and stop there. Okay, after that you basically do some special tests. So the first is Tinel's, where you tap pretty firm, 1 or 2 strokes on both sides to look for any nerve irritation, and the same thing you would do around the elbow. So bend the arm and then tap along the path of the ulnar nerve, 1 or 2 taps, and then continuing with the carpal tunnel examination. This is the modified Falen's test, where you press on the carpal tunnel and do a palmar flexion. Okay, so for the carpal tunnel test, the important one is the Falen's test, where you flex the wrist and also give a little bit of gentle pressure on the transverse carpal ligament, and this should elicit the symptoms of pins and needles in the radial 3 digits. And this is also the reason why patients get symptoms at night, because the hand tends to go into a fetal position, and that's causes pressure onto the median nerve. Okay, so last is the testing for the sensation. So when I touch you there, feel that normal? And that side, and also look on this side and this side. So the median nerve just supplies the radial 3.5 digits, and the ulnar nerve the 1.5 ulnar digits, and that might be altered in carpal tunnel. Lastly, for the carpal tunnel is, can you hold it there for me? Is testing for the thinner group of muscles, which looks pretty good. This is the Froment sign. So normally, when you apply pressure, the finger should be straight. If the patient has got ulnar nerve weakness, then they'll bend the finger because they employ the FPL, the flexor pollicis longus, instead of the adductor pollicis. The other signs for testing the introsei is keep them out spread tight, 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 to see the strength. But this is very subjective. The other way would be to hold it like this, please, and then that also tends to test your introsei muscles. Thanks.